So the first question I'm gonna ask you, I need your name, your age, and what you do here.
My name is Harrell Lightfoot. I am 44 years old. I'm a cardiothoracic surgeon here. I'm also the founder of the Foundation for the Development of Minority Physicians that was partnered with North Carolina A&T to help kids get interested in medicine. In regards to my daily life as a cardiothoracic surgeon, I bring on patients that either have coronary disease or heart disease, valvular disease, and also lung cancer and esophagus.
So what initially drew you to this specialty and surgery in general? What made you stick with it?
So I guess to start out, it was probably my dad. He told me I should either be a doctor or a lawyer. And I really like biology, so I just stuck with that. And for me, the natural progression was to try to get into medical school. While I was in medical school, I really enjoyed my surgery rotation. And I also enjoyed my cardiology rotation. Cardiothoracic surgery was a mesh between the two.
What's a misconception that people have about what you do?
So one, I think a lot of people think that cardiology and cardiac surgery are the same thing, and they're not. Another misconception that a lot of folks have is that when we do open heart surgery, we're actually taking the heart out of the patient's body and fixing it. But we actually do it with everything still connected. I do a lot of off-pump surgery, which means a lot of the operations that I do, the heart is still beating while we're doing the bypass grafts.
Okay.
I guess another misconception, I use the robot a lot for thoracic surgery. They think that there's actually a robot that's doing the operation. But it's almost like playing a video game or just another minimally invasive tool to take care of lung cancer and esophageal cancer.
Okay. So how do you mentally prepare for each surgery?
In the beginning, it's hard because you're really just trying to figure out how you want to get the operation done. But once you've done enough of these, you have enough experience, it's really just preparing and making sure that you've gone over the anatomy, that you understand the disease process that the patient's presenting with. You've got monitors in the operating room that can show you the different vessels that are blocked, the location of the lung cancer, so you can review those in real time to make sure that you're doing the right thing, you're bypassing the right vessel, that you're resecting the correct portion of the lung. But really, it's just like with anything else, you just need to take time to review the information before you make a decision.
So what are some habits or routines that have helped sustain longevity in this field?
Probably working out, because we're on our feet. Probably the shortest operation that I do is probably about 2-3 hours. Longest operation can be 8 to 9 hours. Really just kind of staying in shape, stretching after the operation, waking up early to kind of get some activity beforehand is really helpful. But I guess for me, like, I've always been active in martial arts, so that's really kind of helped me de-stress after a tough week. It definitely helped me get through residency because it helped me get some of the aggression out that I had towards some of my attendings. But just trying to do things that aren't constantly related to your profession is helpful, just so that you're not just in one box 24/7.
My last question I have for you is, what is a piece of advice you give someone considering being a surgeon?
So it's a thin line. So you need to be able to take constructive criticism, but you also need to have enough confidence in yourself to not bash yourself. I think for surgery, it really, people that are kind of perfectionists gravitate towards it because they always want to do things right. And, pay attention to the details and the minutia. But there's always something that could go wrong. And there's enough people out there that are going to talk down to you, tell you that you're doing the wrong thing and whatnot, so you need to have the confidence to know that you did everything that you could for a patient, or you're doing the right thing for the patient. You've read all of the studies. This is the new information, and it's not what we were doing 10, 15 years ago. But at the same point, if you've made a mistake, you need to be able to take responsibility for it.
Thank you for your time.
Sure.